G'day there. Welcome to the Ozone Medical Centre. Just a quick question to help settle an office debate. Do Transformers get car or life insurance? That's what I said. Well, now that I know you can be trusted and that we're on the same wavelength, how can I be of assistance today? I understand you're here for a pre-surgery appointment for an upcoming knee replacement surgery. Okay. I'll just check your booking. Do you know which doctor you're due to see today? Dr. Ollie? Okay. Let me just pull up your booking details. Here we are. Yes, okay. I can see your appointment is booked in for today. Funnily enough, you're actually just a tad early. However, this is a great opportunity to update some of your personal details and confirm some admin side of things. Is that okay if we go through those questions now while we wait for Dr. Ollie? Okay, perfect. Just starting with confirming your full name for me. Okay. And your middle name as well, please. Good. And how about your date of birth? Perfect. And what about your postal address? Yeah, that's right. Okay. And is that the same as your home address? It's the same. Okay. What about your best contact number? On the file here we have 458, a number ending with those. Is that okay? Let's update that one then. A few years old. Okay. All right. Just repeat that one again for me. 472. Okay. Got it. That's it. And you would have received an referral email from your doctor to come to today's appointment. You wouldn't happen to have that copy with you now by any chance? Perfect. Yeah, that's okay. I don't need to see it. Just read the number in the top left-hand corner for me. Should be right about there. Yeah, just that number there for me. Okay, yeah, it should be the 9-digit reference ID. That's all I need to put it into the system. Go ahead and read that one. 412358 101. Okay. Perfect. All those details are confirmed. Thanks for going through that while we wait. I'm sure Dr. Ollie won't be too far away. In the meantime, please help yourself to some complimentary refreshments. We have tea, coffee, water, and some biscuits that I brought in as well. They're from Australia. Tim Tams, you may have heard of them. Little chocolate biscuits that are nice and crunchy and decadent with chocolate flavour. Please, I brought them especially for the patients, for you, so feel free to try some yourself and let me know what you think. But otherwise, when you're feeling ready, please, just behind you, down the hall, first door on the right is Dr. Ollie's office. Have a seat and I'm sure he'll be with you very soon. Okay. I'll see you when you are finished with Dr. Ollie. you wouldn't be here for your pre-surgery knee replacement consultation by any chance? Of course. Nice to see you. My name is Dr. Ollie. I'll be your surgeon performing the procedure in a few weeks' time. Please come on to my office. I hope I didn't keep you waiting too long. But make yourself comfortable, take a seat, and I'd like to explain the reason why you're in today. So, as you know, this knee replacement surgery is coming up in 2 weeks' time. The purpose of today's visit is not only to gather some baseline health markers, but also to examine your knee to see where it's at, and perhaps more importantly, to quell any questions, fears, anxieties, or worries that you may have for the upcoming procedure. So, with that being said, do you have any concerns that you'd like to discuss with me today? Today is the opportunity to do so. I see. You haven't had surgery before. This will be your first one ever. Feeling a bit nervous. Yeah. Well, first of all, that's a very reasonable, completely understandable feeling to be experiencing. Surgery is a major undertaking, but I want you to know that I'll be with you throughout the entire process, including the surgery itself, but also the aftercare while you're in hospital. Yeah, along with a whole host of other health professionals that form part of a multidisciplinary team. We're all here to look after you, to make sure your surgery is safe and successful. But are there any other concerns that you may have? I see. Pain? Not sure what to expect and how much there will be after the surgery, how much pain. I'll tell you what, let me get my gloves on, but I'll be happy to explain that to you. But essentially, there will be a little bit of discomfort after your procedure. That being said, you'll be working with a pain management team to help look after your symptoms to the best of our ability. There's plenty of modern medicines that we can use to help your symptoms and pain while you're recovering in hospital. So I wouldn't worry too much about that at this stage, because modern medicine has come a long way. But you'll also be completely anesthetized during the procedure, so you won't feel a thing while it's all taking place, and you'll simply be asleep. So yeah, I've had patients often describe it as the best sleep of their life. Yeah. But good question, why knee surgery? So essentially, we have identified that your symptoms, mainly the major discomfort and dysfunction that you've been experiencing for some time now, doesn't seem to be responding to other treatment modalities and interventions or treatments such as physiotherapy. So we think the best course of action and the best option going forward will be to complete this total knee replacement surgery in order to help restore as much function as possible so that you can get back to doing the things that you love: work, sport, walking. Yeah, we want you to have the best quality of life possible. Yeah, hence the surgery. Okay, now with all that said, I might go through some vital sign checkups now, just some base health markers that are very useful for us pre and post surgery. So I'll just start off by having a listen to the air in your lungs and simply your lung function. So here's my little stethoscope. I'll just get you to relax and breathe in through your nose and out through your mouth for me. Okay. In and out. Okay. Just a little bit cold. We'll warm this one up for you. Yeah. Okay, here we go. Deep breath in through the nose. And again. Good. Keep breathing for me. Good. Just on the back. Good. Very good. Lungs and airways all seem to be clear. You haven't been experiencing any shortness of breath or coughing lately. No signs of a cold or flu. Very good. Well, let's have a feel just of your index finger now. Just going to pop this one on our little pulse oximeter here. Pulse oximeter. Yeah, we'll just pop this one onto your finger. That's it. Just that one there. Just let that one have a few seconds to read through. It takes roughly 15 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Okay. And just on your other finger for me now. That's perfect, yeah. Just hold that position for me. 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Excellent. Alright, let's come back in normal parameters. Your oxygen saturation is well and truly above 95% there. And beats per minute within normal ranges too. Sitting about 70 at the moment. Yeah. Alright then. Feeling okay? Yeah. Good. Alright, I'll just clean my hands and the stethoscope there. Because we'll just check your blood pressure next. Now, are you on any blood pressure medication at this stage? Okay. Alright, yeah, that's a good question as well. It will be good to bring in your usual medications when you do come in for surgery in a fortnight. We recommend roughly 3 to 4 days worth of your usual medications. Yeah, just so you have it on hand. Not that you'll necessarily stay for that long, but it's just good to have more rather than less. Okay. Now, let's check your blood pressure. Which one's your dominant hand? That side? Okay. Let's do that side then. Doesn't really matter, it's just some people prefer it on the dominant, non-dominant. There we are. this little crinkly cuff on your shoulder there, or your upper arm rather. This is our manual device, our sphygmomanometer. Yeah. Alright. And you'll just feel a little bit of a cold touch as I place the stethoscope on your upper arm. Just placing that one in the cuff on your arm there. Okay, just try to stay still for me. Just going to pump that one up. Nearly there. Okay, just releasing some of that air. There we go. Very good. Get that strap off there. Okay, blood pressure is also looking within our normal parameters. Always a good sign. Okay, let's just have a quick check of your eye reflexes now. So, just looking at my two fingers here. That's it. Just focus on these two fingers. Just going to bring this light towards your eye. A bit of stimulus there for the pupil. Okay, just keep your finger here. Keep your gaze on my finger, rather. That's it. Good. Okay, just on this side now. That's it. Keep focus on my two fingers here. Very good. Very good. Stay focused. Right here. Right here. Just up here now. Good. Just over here. Good. One more time. Okay, perfect. It's looking good. Now, just keep your head still and follow my finger now with your eyes. Keep your head still. That's it. Good. Still keep following my finger. Don't move your head. Stay completely still. Good. Stay still. Just this finger now. Up and down. Up and down. Okay, just try to stay focused on my thumb. Moving away. Moving in. These two fingers in. And in. And in. Okay, just hold that position. Hold that position for me. Good. Nice. Okay. Alright, eyes are looking good. Normal reflexes there. Yeah. That's good. Feeling okay. Alright. Well, let's move on now to a physical check of your knee itself. Now, to be 200% certain, we are operating on your right knee. And don't worry, we will be marking it on the day of the surgery so that there is no room for error. But yes, 100% we'll be doing your right knee. So just having a quick look at your knee there, I'll just have a feel of that one. Do you mind just lifting up the pants just to the top of the knee? That's fine. That's good there. Okay, I'll just have a quick feel on the sides there. Okay. Very good. It's a little bit of swelling there, just on top in that sort of quadriceps region, but that's quite normal for what we would expect a little bit of heat and tenderness to touch, yeah. But that's, again, we're going to expect these sorts of things. So, we wouldn't be operating otherwise, if you know what I mean. So that's good. So a bit of heat, a bit of swelling, a bit of tenderness. Yeah, I know it's been going on for quite a while too now. Let's get a quick measurement of those knees, just comparing both sides. So here we are. All right, just wrapping this measuring tape around that knee. Good. Roughly. Good. 42, 43, 44, 45, 46, 47, 48, 48, 49. Okay, just comparing it to your other side now. Just over here, wrapping that one underneath and around. Very good. 43, 45, 46, 47. All right. So the good news is it's only slight difference there. The left knee is understandably a little less circumference, but that's normal considering your right knee has a bit more swelling. So not a huge change, but definitely indicates a bit of swelling in there, but nothing too abnormal. Yeah, nothing outside of the usual ranges that we'd expect pre-surgery. How are you holding up? Good. All right, because now we're going to go through a few movement checks. So what I'd like you to do is just on your own, try to straighten that leg out for me. Yeah, while you're sitting is fine. That's good. Go ahead and try straighten for me. Okay. And then how about the other side? Yeah, can you fully straighten that other side? Good. One more time on your affected leg, on the right side there now. Good. Okay. And that's painful towards the end range there. Let's see. Okay. I'll just give my hands a quick clean here. Just going to have a feel and what we call passive range of movement, where I will move the knee and the leg for you. You just need to let it go loosey-goosey, let it relax, let it go heavy in my arms. Okay, don't try to help me. Just let your leg go loosey-goosey and relax. Okay. Yeah, alright. Just gonna straighten, bend, straighten, bend, straighten, bend, straight, bend, straighten, bend that one. Okay. Is that bringing on any of your symptoms? Okay. I see. And now I'd like you to kick against my pressure. Okay, just trying to straighten against my pressure here. That's it. Meet me, don't beat me. Meet me, don't beat me. Meet me, don't beat me. Good. Alright, and then one more time. Meet me, don't beat me. Meet me, don't beat me. Good. Alright, now we're going to do a maximal strength test. I want you to try and straighten your knee out. Push through me this time. Okay, before you were meeting my pressure, now I want you to beat me. Okay, so try to push through, beat my pressure. That's it. Good. One more time. Push through me. Good. Alright, let's try your other side for comparison. So try to push through me this time. Push through me as best you can. Good. That's it. That's it. Good. One more time. That's it. Okay. So there is a little bit of strength deficit, a bit of weakness in the affected limb, which we would expect at this stage. primarily due to disuse, a bit of atrophy starting to occur. The muscles don't get used as much, therefore they waste away a little bit, but this is quite normal pre-surgery. And post-surgery will definitely get you with the physiotherapists to start mobilizing and some simple strengthening exercises to help address that as soon as possible. Yeah, they'll get you up walking the same day of the surgery. It's very typical. There's a lot of evidence to say that getting up and moving early is going to lead to better health outcomes in the long term. So, yeah, it might seem cruel. Might call them physioterrorists, but it's a good thing. Yeah, early movement, early mobilization, early strengthening is going to be really good for your long-term outlook. I promise. Okay, well, let's have a look at some of your tendon reflexes now. I've got my little tendon hammer here. I'll just be tapping on the front of that knee to make sure that your brain reflexes and the communication signals to your knee region are working okay. So just going to feel a little light pressure into that kneecap tendon, okay, just below the kneecap there. So, alright, just holding that position. Good. 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 Nice. Just seeing a bit of jolt. That's normal. That's it. Your knee tendon should start to contract just with the pressure of the hammer here, which is normal. That's what we want to see. Yeah, this shouldn't be painful or discomfort. Good. Alright, that's good. And then just on the back end of this one, just a little scratchy point here. Not sharp or anything, but just a little scratchy point. Just gonna get you to close your eyes for me. I want you to tell me whether you can feel this sensation or not, okay? Just with this little point. So, closing your eyes for me, no cheating. How many fingers am I holding up? Good. Yes, keep your eyes closed. That was a test. Alright, here we are. Can you feel that? Can you feel this? Can you feel that? Can you feel this? Can you feel that? Can you feel this? Can you feel that? And can you feel this? Okay. Very good. Feel free to open your eyes there. Everything's looking as it should be with the knee. Everything's as we should expect it. No dramas, nothing abnormal or out of the ordinary. I think it just highlights the need for surgery, to be honest, yeah. But, like I said, no dramas. So, we'll just do one little test, actually, before we answer a few more questions, if you have any. Just another little sensation test with my cotton swab here. Same thing, closing your eyes for me. Just want to make sure you can feel soft touch. So yeah, just let me know if you can feel this. Can you feel this? Can you feel that? 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 Okay. Very good. You can open your eyes there. Doesn't seem to be any sensory deficits or anything abnormal with your neural pathways to the knee area, which is always good to see. Okay. Alright, we're nearly done for today's pre-surgery consultation. I have all the physical parameters, but did you have any other final questions or anything else you would like to ask before finishing up today? So the question was, how long will you be asleep? That's actually a really good question. So you'll be under the effects of general anesthetic for the duration of the surgery, which usually lasts anywhere between 1 and 2 hours. Between 1 and 2 hours. You will be in the surgery room for a little longer than that, just to allow for preparation time before, as well as a bit of recovery and monitoring time post-surgery. But immediately after that, our wardies will transfer you to the orthopedic ward at the attached hospital, whereby you will likely stay for several days, and then you'll get discharged home, depending on your speed and recovery timeline and time frame. But it's a very good question, and like I said, you'll be looked after through every step of the way. I'll be with you during and after the surgery as well to check in on your progress. So, yeah. Any other questions? That's fine, go ahead. I'm just going to jot down the findings from earlier, but yeah, if you need to think, take your time. Today's appointment is all about you. Yeah. Is there you need to bring anything before you come in? Another good question. So all you'll need to bring really are some loose clothing items, pretty much like what you're wearing today. Nice comfortable clothing that allows us to access your knee easily. Yeah, nothing too tight, nothing that you want to really preserve, and nothing too fancy, I guess. I'd also like you to not wear any jewelry, as we'll have to remove that otherwise. The other thing, thanks for reminding me, is I see you don't have any on now, but please don't have any nail polish on while you come in, just so we can monitor your pulse oximetry with our little device here that we used on you earlier. It just, the nail polish can mess with the infrared scanning on the finger if you have that on, so we just, it'd be easier for you not to have it on. Yeah. Yeah. Any other questions? No? Okay. Well, I've got everything I need from you today. All that's left for you to do now is take care of yourself, look after your health over the next 2 weeks, and if you have any questions at all, please feel free to give our unit here at the Ozone Medical Center a call. I'll get my receptionist to give you a pamphlet with everything we've spoken about today, so you don't have to remember anything. Yeah, it's all there for your reference and review as you so wish. Okay. Alright, well, thank you for coming in. I really do hope that you feel a bit more reassured and know what to expect going into surgery in 2 weeks' time. I look forward to seeing you with a brand new knee and have a wonderful rest of your day. Just have a chat to our receptionist before you leave and they'll sort you out with all those details. But that's it from me. It's been great working with you today. And I'll see you in a few weeks. welcome back. How did your appointment go with Dr. Ollie today? I see. I'm glad it went well. I know surgery can be quite a major event, but I'm sure you've left today with more answers than questions. But that being said, if you do have any questions, I'll send you through a pamphlet with the summary document that Dr. Ollie would have mentioned for your perusal and reference. On that little pamphlet, there will be a contact number for our direct office that will come through to me, receptionist, and I can put you through to Dr. Ollie if you have any questions or queries from now until the surgery date. Speaking of which, I'll just have a look in the file. Here we are. I see you're booked in for a fortnight, 2 weeks from now. Okay, well, I'll make sure you get a reminder text message to your contact number from earlier. You'll also get an email about 2 days before the surgery, but just in case, would you like an appointment card? Yeah, that's no trouble. We can definitely do that. Okay, yeah. Here you go. Just take that one, and that way I'm sure you won't forget. Alright. All the details are taken care of, so that's all we need from you today. You're free to go. Of course, take care of yourself from now until the surgery date, and we'll see you soon. Okay, have a great rest of your evening. See you then. Thank you to my awesome patrons, Andres Orlan Vasquez, James, Astor, Scott Walker, Kirsten, Josh, Patrick, Gabriel C., Will Hume, Emma, Here's Mikey, Chad Moore, James P., Taylor, Gary T.,